I'm joined now by Jidong Huang in Shanghai. He's an associate professor at Georgia State University's School of Public Health. So, Professor, China has been working, as we know, to address this health issue. There's a smoking ban, several new laws, but the numbers are still rising in the country. So what more can be done to turn things around?
Yes, so in addition to implementing smoke-free bans, there are other ways that the Chinese government can do to reduce tobacco use, which is the single most important contributors to lung cancer in China. For example, China can further increase tobacco tax and offer smoking cessation services to smokers. In addition to that, warning smokers about the danger of smoking through adopting graphic warning labels.
You mentioned fines. That's something that also is being used to sort of deter people from smoking. But is it also about changing a culture of smoking? How do you change a culture of smoking?
Yes, social norm is an important factor that influences smoking behavior. That is where the smoking ban can play a major role. Smoking ban in public places can lead to a change in social norm and a change in perception of smoking. So educating kids and young adults that smoking in public places is not acceptable and is against the law. So smoking-free air policies will change social norm and when implemented with other tobacco control policies, it can significantly reduce tobacco use, which leads to a reduction in lung cancer.
So lung cancer rates are going up in China. How much is air pollution playing a part in that?
Air pollution is also increasingly playing an important role in contributing to lung cancer in China. But tobacco use is by far the most important factor. 80% of lung cancer death rates are attributed to tobacco use.
You know, a lot of people are turning to vaping to get away from smoking cigarettes. We see that in a lot of younger people. What do you think are the biggest misconceptions when it comes to vaping, and what are some other tips that you can give to help prevent lung cancer?
Sure. So yes, vaping is becoming more popular, especially among younger generation. However, the scientific evidence on vaping or electronic cigarettes is still evolving. Electronic cigarettes appeared in the commercial market in the United States only in 2006, so it's barely 10 or 12 years. We still have a lot to learn about the long-term health consequences of using electronic cigarettes. But based on the current scientific evidence, the consensus is that for smokers who are unwilling to quit or unable to quit smoking, switch completely from combustible cigarettes to e-cigarettes is going to lead a reduction in health risks for those smokers. However, vaping should not be, the electronic cigarettes is a nicotine product and should not be used by kids and should not be used by never smokers. In addition to using alternative nicotine tobacco product, I think other things that Chinese government and people can do is to, again, reduce tobacco use and reducing air pollution. And those two are the major factors contributing to lung cancer.
You know, Professor, a lot of adults still remember the days where they would see and be part of people smoking on airplanes.